What's up, guys? This is your boy Miguel giving you your daily dose of radiation. Today's video, we're covering X-ray student clinicals, do's and don't. So to give you context, I'm a night shift X-ray tech, 7 on, 7 off, and I work a lot of overtime, so I dabble in the day shift. So I remember pretty vividly what it was to be a student and where I work at. We have students who are X-ray techs. I would say both some advice that was given to me from my teacher and other techs who were instructors. More for the first year students. Majority of your personal life should stay at home. Please don't intertwine your. I know sometimes depending on some techs you want to open, you want to just keep your personal stuff to yourself. Most of them don't care. It just becomes drama. Just whatever happens at your other sites. And you're like, hey, they do this like this at so-and-so. Hey, don't do that. It's a rookie mistake. You're just going to piss them off because they're like, well, we don't do that. Or we don't have that machine. Or da-da-da-da. Like, there may be a rivalry amongst hospitals. Just don't. Just don't do that. I would say with certain techs it's more easier to get along with and to be more friendly or to be more chit-chat. I remember there's one tech in particular, he still works at where I work at, where we would vibe so good and it would become, I would feel like I was like a real good friend with him, and then a part of me didn't know, there's a level of professionalism / you're trying to be cool. There's like a fine line. Some techs are pretty chill. I'm pretty chill and pretty cool. So the professionalism doesn't always have to be, because we're not all, even though we're in the medical field, we're not all professional all the time. We're not all robots. We have a sense of humor. We're some techs expect you to be professional the whole time and and if you dabble into pushing the non-professional route just to try to be cool, some techs will get mad, upset, report you to, other ones won't. So it's you just rather just stay professional the whole time. Just go down that route. I was antisocial, so I really didn't talk much. I just got there and just whatever they needed to do, I would do, and that's kind of about it. I would say always ask, don't assume the positionings, because depending on where you work or even depending on what they're seeing, they may ask for a certain view or certain different views on certain exams. It may be a shoulder, but they want a Xray view instead of just a regular shoulder. So always ask if it's just the regular ones. What else? Before you leave anywhere outside of the department, always ask if you want to go to the bathroom or if you're trying to take lunch. So maybe they know where you are. Always make sure that someone knows, because if your instructor look for you and no one knows where you are, you can get in trouble. Always try to follow the protocols of the hospital / if your instructor was there, because certain techs are more, how do I say, there's some texts that are more by the book. This is how it has to be, because when I was a student, this is how it was. And then there's other ones who are more chill and more laid back. So you just kind of have to give or take depending on where you are. Certain comps aren't, you would assume that you would have gotten them, but you don't because you didn't have your marker or because of this. And all that will come with time at wherever you're at. Let's see what else. Another big one I would say is your technique and stuff. Depending on your machine, depending on what stuff that will vary. Don't always assume that because you shot something with another place, or even even now as a tech, even though there's two portables that look the same, they all have their own little quirks, their own little things. So technique-wise will always vary depending on what you're doing and stuff like that. Yeah, it's been Miguel. See you on the next one.